Good afternoon, everyone. I am Guillermo Medina, the Executive Director of the Los Angeles County Commission on Disabilities. I'm a 50-year-old male Hispanic with salty hair and saltier beard. I'm wearing a black suit, white shirt, and a black tie. I'm also wearing, in honor of today's webinar, a ribbon that I received when I did the MS walk with my daughter Tiffany a few months ago. I'm also wearing an orange pin in honor also of today. I'm here today as your moderator on our first ever webinar on multiple sclerosis, or more commonly known as MS. We hope this webinar provides you with information on resources available in Los Angeles County so we can help bridge the inequity gap and we can continue to advocating for families who need resources. As this is our first MS webinar, we wanted to have speakers that address MS from different views. We are asking that you type in the chat any questions that you may have for our speakers and will be addressed after the presentations. If we run out of time, we will make sure that we send your answer afterwards. We also have American Sign Language services for those that might need it. Please feel free to spotlight our ASL translators in your settings. Now, it gives me a great pleasure to introduce our Aging and Disabilities Director, Ms. Maral Karakusian.
Hi, everyone. Good afternoon. Thank you so much for joining us today. I'm Maral Karakusian, the Director of the Aging and Disabilities Department. I'd like to begin by thanking the Los Angeles County Commission on Disabilities for hosting this webinar and for their continued leadership in advancing accessibility, equity, and inclusion across our county. March is recognized nationwide as Multiple Sclerosis Awareness Month. Today's webinar focuses on multiple sclerosis, a condition that affects many members of our community but is often misunderstood. Multiple sclerosis, or MS, is a chronic neurological condition that can be unpredictable and may present both visible and non-visible symptoms. For many individuals and families, it can affect daily life in different ways over time. Across the US, nearly 1 million people are living with MS, making it one of the most common neurological conditions. Here in Los Angeles County, the National Multiple Sclerosis Society estimates that more than 11,000 residents are living with MS. These numbers highlight why awareness, access to reliable information, and connections to services are so important. Earlier this month, on March 3rd, the Los Angeles County Board of Supervisors officially proclaimed March as Multiple Sclerosis Awareness Month, reaffirming the county's commitment to advancing disability access and supporting residents living with MS. The Los Angeles County Commission on Disabilities continues to play an important role in bringing attention to issues impacting the disability community and helping connect residents with information and resources. We have an excellent panel joining us today that brings together medical expertise, advocacy, and lived experience. We hope today's conversation helps deepen understanding, sparks meaningful dialogue, and strengthens connections to resources and support. Thank you again so much for being here. I will now turn it over to our panelists.
Thank you, Director Karakusian. So we will proceed with our first presenter today, Ms. Kate Norton. Kate began her career at the National MS Society in 1996 and has spent nearly 3 decades serving the organization and the MS community in a variety of leadership roles. She has mentored staff, partnered closely with local and national volunteer leaders, and helped shape innovative fundraising efforts and have contributed to the Society's national fundraising strategy, whether building relationships with donors, creating meaningful events, fostering authentic community connections, or ensuring people are connected to the resources they need. Kate builds and mobilizes communities to help advance the Society's vision of a world-free MS. Kate is deeply committed to advancing the mission to help people live well and MS. 11 years into her career, Kate's older brother was diagnosed with MS in 2007. Kate, you're on.
Thank you, Guillermo, and thank you to everybody who I'm sharing this panel with. I'm just going to start the day by just letting you know that I've been suffering from a little bit of COVID this week, so please ignore my voice. The heart and intention and being here is big, so thank you very much, everybody. I'd like to first begin by, next slide, please, letting you know a little bit about our founder, Sylvia Lowry. Sylvia founded the MS Society in 1946 because 1 year previous, she had placed an article in the New York Times that said, "Multiple sclerosis. Will anyone recovered from it please communicate with patient?" From that social media of her time, she got 54 responses. And 1 year later, she founded the MS Society in New York City. And 1 year after that, the first chapter was founded here in Los Angeles in 1947. Next slide. Our vision at the National MS Society is a world free of MS. And our vision and our mission is we will cure MS while empowering people affected by MS to live their best lives. Next slide, please. Every 3 years, the National MS Society comes up with a strategic plan that focuses at the hearts of our mission and our work. Our current strategic plan focuses in 3 key areas of work, the most important areas: accelerate cures, improve healthcare access, and inform, connect, and support people living with multiple sclerosis. We accelerate cures by funding research the world over. Our purpose is we want to invest in MS research to stop MS in its tracks, help people restore what has been lost, and ultimately end MS forever. We also want to invest in the future generations of MS researchers and clinicians. We also want to improve healthcare access by earlier diagnosis and equitable access. And what we mean by that is the earlier somebody can be diagnosed in their MS journey, they don't lose precious time in trying to live their best lives. The sooner we can get people diagnosed in this journey, the better their long-term outcome can be. And we want people to be able to access healthcare wherever they are. And getting equitable access, we're very lucky here in Los Angeles to have access to hospitals and the best MS specialists the world over, but that's not the same for everybody in the United States here. So we want to help improve healthcare access by working with local neurologists so that they can spot MS earlier. And finally, we want to help inform, connect, and support people. And we do that by providing a key service, by being a trusted partner through our MS Navigator program. I'll touch more upon that in a little while. Excuse me. Next slide, please. When we think about accelerating cures, I just want to highlight a few key things that we did last year. We awarded 28 new fellowships and early career grants and added $8.7 million in new and multi-year commitments in MS research. We also committed to funding 16 new investigator research grants, adding an additional $9.4 million to our portfolio in multi-year commitments. And also, something I'm very proud of is that in 2012, the National MS Society launched the International Progressive MS Alliance with global alliances from all over the planet to help accelerate cures for people living with more progressed MS, because currently there are no solutions for people living with more progressive MS, and we need to change that. Next slide. In the area of improving healthcare access, last year we outreached to approximately 4,000 healthcare professionals regarding the updated 2024 McDonald Diagnostic Criteria and revisions. We also established a partnership with the National Rural Health Association to expand access to care in rural communities and raise awareness. We also connected with 2,000 hospitals and 5,000 clinics. And we also had referrals from clinics to the MS Society for more than 1,000 referrals to our MS Navigator program. Next slide, please. When we think about inform, connect, and support, the National MS Society has a program called MS Navigator. And this is a group of highly skilled, compassionate professionals who will take your call if you call needing anything at all, from the spectrum of you're newly diagnosed, you're looking for a healthcare provider, you're looking for an online community, you're looking for financial resources, anything that you need in your MS journey, the MS Navigator can help you get what you need in every community across this country. It's it's the gem of a resource that the National MS Society has that's open to everybody in the organization. Next slide, please. Last year, MS Navigators helped nearly 23,000 people find personalized solutions that they needed to help address their MS challenges. We had 33,000 people connect through our online communities, and we had more than 500 support groups across the country that were both in person and virtual. We had 400 one-on-one pairings through our MS Friends peer support group. And the MS Society also helped relieve $613,000 in medical debt that people were just owed. So that's a key resource that the MS Society can help provide. Next slide, please. The National MS Society also offers a variety of nationwide programs that are available to anybody. Ask an MS Expert, Black MS Experience, Everyday Matters for kids, Keep Smiling, Free from Falls, Hispanic Latin MS Experience. These are just all programs that anybody can access, and it can all be accessed through our website. Next slide, please. Thank you. Here in California, we have 3 chapters, and we are the Southern California chapter. Here in Southern California chapter, we serve nearly 21,000 people who are registered with the National MS Society. And here in LA County, it's just a little bit more than 11,000 people who are registered with the MS Society who identify as having multiple sclerosis. We, of course, probably know that number is bigger, but that's as many people that are registered with us. We have 12 staff members who work here, and we all work remotely. We have 3,400 activists, people who advocate at Capitol Hill and the state and federal. And we have 30 members of our board of trustees. Next slide, please. We also have 15 self-help groups here in all over Southern California. One you'll learn from a fellow panelist, the Forest Downey MS support group. You'll hear about that in a little bit. But these are ways that self-help groups help people with MS to feel less alone and finding others to talk to about what their experience with MS is. Next slide, please. We have at UCLA, we have the Marilyn Hilton MS Achievement Center program, which is a 1-day-a-week program that people can attend if they would like, or there are online and hybrid options as well. Some of those, they're called Beyond Diagnosis, a cognitive fitness program, Living Well with MS, Exercise MS, and Free from Falls. Those are all actively happening on a quarterly cycle. You can call our colleague Cara Delaman over at UCLA if you'd like to learn more about this. Next slide, please. So the MS Society here in Southern California has lots of ways that people can get involved to make connection and to fundraise. We have all of our walks coming up, and I'd like to say thank you to LA County. You are one of our biggest supporters of our LA walks. And so we just so appreciate all the agencies that get involved with Walk MS. We have our first walk coming up this weekend at Inland Empire. Our Greater Los Angeles walk at the Rose Bowl is coming up on the 29th. Hopefully some of you are registered for that. We have Bike MS coming up at the end of May. And we have our Dinner of Champions in September. Next slide, please. So if anybody ever wants to get involved, they could just go to our website, call me. I can be your contact as well. There's ways you can become an advocate. You can sponsor an event. You can start a team. You could buy a dinner, a table at the dinner, and all this goes to helping create a world free of MS. Thank you very much. Appreciate the time to let you know more about the National MS Society. Thank you.
Thank you, Kate, for a very informative presentation. Our next presenter is Dr. Brooke Guerrero. Dr. Guerrero is a fellowship-trained MS and neuroimmunology specialist. She currently works at Olive View UCLA Medical Center and Rancho Los Amigos National Rehabilitation Center. She completed her neurology residency at Los Angeles General Hospital, Keck School of Medicine, and her MS neuroimmunology fellowship at Cedars-Sinai Medical Center and UCLA. She previously served as a medical student site director at Olive View, UCLA, for the UCLA School of Medicine, and currently serves as a clinical instructor for trainees at all levels of training, including neuroimmunology fellows. She is actively engaged in investigator-initiated research with the focus on the impact of socioeconomic status on prognosis in MS. Welcome, Dr. Guerrero.
Hello, everyone. I'm so happy to be here. I'm glad that we're doing things like this where we can all put our heads together to better serve our patient population better. So I'm going to give a quick overview of MS and kind of the clinical management of it, but I'm going to start with how we diagnose it. So next slide. Okay, so I'm going to start with a case. So this is a 22-year-old male coming in with right leg weakness for the past 3 days and left arm and leg numbness. He endorses a history of prior fluctuating weakness since age 18. This included left leg weakness when walking and when working out in the gym. This prior weakness usually would resolve after 1 week. On my review of systems questions, the patient also endorsed that he was having urinary hesitancy and constipation. Next slide. So this was his physical exam. So he had some weakness in his right hip flexor and also reduction in his ability to feel vibration in the left arm and leg. His reflexes were normal, but walking testing, he had a wide-based walking with dragging of the right foot. All right, so this is what the patient's MRI showed, and I'll discuss these MRI findings in a little bit. All right, so these MRIs were ordered on an outpatient basis. It took the patient a little time actually to get established with me, approximately 6 months. And by that time, he was feeling a little worse. But I made the diagnosis and started him on one of our high efficacy medications, rituximab, as quickly as possible. And fortunately, this led to disease stabilization. And he's actually been relapse free for the past 5 years, but he does still struggle with some chronic symptoms, including leg fatigue at the end of the day and erectile dysfunction. So this is a really classic case of MS, and it highlights a couple things. So one, it highlights this need for being able to recognize MS quickly. If people are not familiar with the symptoms, sometimes they might not suspect it, and then that can lead to treatment delays. And the other key point is that starting medication does significantly improve prognosis, so we like to get that started sooner than later. I had a diagnosis slide that basically reviewed the symptoms of MS. I can just let you know though. So the classic symptoms of MS are actually vision loss in one eye, numbness or weakness on one side of the body, or brainstem symptoms, including double vision or vertigo, and then also not being able to coordinate your movements very well with arms and legs. And so we actually make the diagnosis of MS using that clinical history plus MRI findings. So the MRI findings that my patient had, those are very classic for MS. So MS is a CNS disease that leads to lesions in the optic nerve, brain, and spinal cord. And so me as the clinician, I look for those key MRI findings in a patient with the right history, and that's how I make the diagnosis. Sometimes I will request additional testing, including blood work to rule out other conditions that can mimic MS. And then sometimes I will recommend a lumbar puncture to look for evidence of inflammation in the spinal fluid. So once I have made the diagnosis, I make sure I get my patients who need it onto treatment as soon as possible. The treatments that I use are tailored to the patient. So depending on the severity of a patient's MS, I will use either a low, moderate, or high efficacy medication. So for my patient case in the beginning, I was concerned about the aggressiveness of his disease. So I put him on a high efficacy medication right away, which was rituximab. So this belongs to a class of medications called B-cell depleting medications. The other options that we have in this class are ocrelizumab, ofatumumab, and ublituximab. So I use these medications a lot because they work very well. And actually you can see this was a meta-analysis where they compared the efficacy of the different MS treatment options. And so these numbers here refer to the medication's ability to control relapses. So the B-cell meds are all here at the top of the list, showing that they lead to significant reduction in the risk for relapse. Okay, so another part of my management is actually managing the symptoms of MS. So these symptoms include neurogenic bladder, neuropathic pain, spasticity, fatigue, helping improve walking speed, depression, and some of the cognitive issues that can occur with MS, such as reduced processing speed. So for these symptoms, I will offer specific treatment or therapy options. Okay. All right, so progression in MS. So this is a really important topic. And to explain what progression is, so this is the second part of MS. So I mentioned the relapsing part of MS. The second part is progression. What patients feel is an ability to, or not being able to do something that they could do a year ago. What I confirm when I see them in clinic is a change in their exam. And most importantly, the best tool that we have for monitoring for progression is actually the timed 25-foot walk test. So I measure how long it takes patients to walk that distance. And if it's getting slower, then that makes me concerned that they're having progression. So progression can be related both to relapses, and that's the part that we actually are pretty good at eliminating, or at least improving. But progression can also be independent of relapse activity, and this is really the more challenging part of MS to treat at this point. Okay, next slide. So what is causing the progression? We think it's due to these chronic type lesions. So acute lesions that predominate early on in MS and in patients with relapsing MS are these acute demyelinating lesions, but patients with a more progressive course have these chronic lesions with this little rim of immune cells, specifically the macrophage cell. And we can actually visualize these types of lesions with these new imaging biomarkers that we have called paramagnetic rim lesions. So an example would be, actually, they don't have it on here, but it would show up as a lesion on a certain sequence that has a dark rim around it. So we have newer literature suggesting that patients that have a large number of these lesions, this is correlated with a more progressive course. So we think this is a convincing theory for the pathology underlying progression. Okay, next slide. All right, so another important factor that is relevant for prognosis is actually environmental factors, including socioeconomic factors. So I think this is actually a really relevant topic for this meeting, and this happens to be one of my research interests. So this retrospective study that I did for one of our recent MS conferences had to do with testing this question of how relevant is socioeconomic status for prognosis in MS. I looked at 110 of my patients, and we have a very unique population in the county, which is a very diverse population. But luckily, the resources we have in the county are actually very good. So 84% of my patients were treated with high efficacy medication. So basically, any of my patients that I felt needed high efficacy medication, they were able to receive it. And so 70% of my patients actually had no evidence of disease activity. But their average disability score is kind of in the middle of the scale. And then to look at socioeconomic status, I actually used this score that the Department of Public Health provided to me, which is the California Healthy Places Index score. So this assigns a score based off of zip code, and it uses different metrics, different indicators to calculate life expectancy at birth. And so on this scale, lower scores indicate a less well-resourced neighborhood, higher scores, a better resourced neighborhood. And so I did find this trend that patients living in a less well-resourced neighborhood did have a trend towards higher disability. So this is important because this is actually something that we could potentially modify if we identify why this association is occurring and can maybe develop interventions to be able to remove this as a risk factor for advanced disability. Okay, next slide. All right, so how do we treat progression? So it's not a completely hopeless situation. We actually have one FDA-approved medication for primary progressive MS, which is ocrelizumab. So this one actually had a positive trial, so I was able to get that FDA approval. For a variety of reasons, sometimes I will use the other B-cell meds. in place of that. But this is technically the only one that is FDA approved. If my patients are still progressing despite these medications, I have been moving on to cladribine, which is a medication that's currently being studied in advanced MS. So we don't know for sure that it will help slow down progression, but we hope that it will. And then an exciting update is actually there's a new class of medication that's being studied in progressive MS, which is the BTK inhibitor class. And one of those medications, which was fenebrutinib, actually did have a positive trial recently. The trial was actually designed to show that this was non-inferior to ocrelizumab for primary progressive MS, and it was found to be non-inferior. So luckily, this one will move closer to FDA approval, hopefully. And then these other options are things that I get asked about sometimes. So patients are very interested in stem cell therapy, and the type of stem cell therapy that would be relevant for progressive MS is mesenchymal stem cell therapy. The idea is that these would help encourage regrowth of damaged parts of the nervous system. But there's really only preliminary studies of this intervention so far. I put these on here because these were two supplements that were actually studied in progressive MS, but unfortunately they failed. And then these other two options are very aggressive ways of treating MS. Technically, they are an option as a last resort if we wanted to try them for progression, but really they're more designed to treat highly active relapsing MS. So thus far, I have not actually used these last two options for progressive MS. Okay, slide. Okay, so living well with MS. In addition to my clinical care, I try to take into consideration and support the overall wellness of my patients. So that starts with making sure the lifestyle is good. So I encourage smoking cessation since smoking is associated with worse prognosis. I encourage a heart-healthy diet. Mediterranean diet seems to be the best of the diets. I make sure they have cardiovascular risk factors managed with their primary care. I refer them to physical therapy, and I am very fortunate to be at Rancho Los Amigos, which has some of the best physical therapy in LA County. If needed, I provide work accommodations for my patients, or I plug them into disability resources. I make sure they get all the adaptive equipment they need, and then I really highly support my patients being involved in the support groups, especially the group we have here at Rancho. And I would like to give a shout out to Shannon. Shannon has been just a immensely beneficial resource for me, and he makes a huge difference for my patients. So I really appreciate his work. And last, for patients that need caregiving, I do ensure that they get those resources. Okay, next slide. Okay, that's all I have. Thank you.
Thank you, Dr. Guerrero. Our next speaker seems to be like the rock star of our panel today. He is Shannon Triplett. Shannon was born in the County of Los Angeles and was raised in Inglewood. He's a former designer, owner of custom design and installation, kitchen and bath dealerships in Apple Valley, California. Currently, he serves as a peer mentor supervisor for neuroservices and diabetes limb preservation with No Barriers peer mentoring and life coaching services at Rancho Los Amigos Rehabilitation Center, and is one of the current leaders of the Forrest Downey MS Support Group with the National MS Society and MS Foundation. He was diagnosed in 2012 with MS. Shannon?
Thank you for that introduction. It's been a pleasure to be able to work with Kate and Dr. Guerrero. I am Shannon Triplett, peer mentor supervisor for neural services and diabetes and limb preservation here at Rancho Los Amigos. Peer mentors are individuals that are part of support for the patients. We are individuals that are a part of their team along with their therapists and doctors. We're also individuals that provide resources, help them to optimize their services here at Rancho. We help them to normalize their actual situation and whatever their disability is. And we provide hope for them And what we do is we work with the patients, we become friends with them, we become their guidance because we've moved forward ourselves, which is really great, and we appreciate that. One thing is, it's not just MS. We also handle other disabilities as well, brain injury, stroke, spinal cord injuries. So we have an abundance of services that we do work with. So that is a great thing for us. I want to thank the ladies for also mentioning me because I too live with MS. So I am one of the co-leaders for the MS The Force Downey, we're an MS support team. We happen to meet here at Rancho Los Amigos every Thursday from 10 a.m. to 2 p.m. The great thing about coming to a support group, we all have MS. So we don't have to explain how we look or how we feel. We all understand it. We can help educate each other. We help tell each other our own experiences and what we've gone through and help each other to move forward. And it's about living a quality of life. It's about moving forward in our daily life. And we'd rather be 6 feet above ground than 6 feet below ground. We are individuals that live with the disease, but we're not going to die from it. And I appreciate being a part of this. I am one of 2 leaders. I want to give a shout out to Julio Benavides. He is the other co-leader for the group. And like I said, we meet every Thursday from 10 a.m. to 2 p.m. I appreciate it. If you have any questions, please feel free. I have a couple flyers up. There's a way to be a peer mentor here at Rancho Los Amigos, and we are strong. And then there's the flyer for the Force Downey, which is the support group. And with that support group, it has my contact information. Please contact me if you'd like to come to the group. That way we can put you on the roster to get into the building. I appreciate it. I appreciate this platform to be able to speak. Thank you very much.
Thank you, Shannon. Thank you for your words of encouragement and inspiring others to be part of this movement. We have a few questions. We have time for some Q&A, so feel free to type in your questions right now. Our first question is for Kate. What is your advice to family members and friends when someone in their circle is diagnosed with MS?
Thank you for that question. When somebody is diagnosed with MS, it can be very overwhelming. So I think you want to show up with wanting to learn and be educated. And MS affects everybody differently. So in doing your research and learning more about MS and being present and supportive, you're going to learn a lot about multiple sclerosis, and you're going to learn that some days the person in your life needs support and other times not as much. So I would also encourage anybody who's been newly diagnosed with MS to connect with the MS Society and through our MS Navigator program as a place to start on this journey, that we can be with you throughout to help you learn about whatever you might need. Thank you.
Thank you, Kate. This next question is for Dr. Guerrero. What is the best way to handle when someone with MS is experiencing double vision? I know you touched on it in your presentation earlier.
Sure. Yeah, so double vision actually is one of the symptoms that is very classic for MS. So if it's a patient that has never had that before, they certainly should be admitted to the hospital for a complete workup, typically with MRIs. And then if MRIs show an active MS lesion, they would be able to get treated right away with IV steroids. If it's a patient that's already has MS and they're telling me at the visit they have a new symptom and I confirm it on my exam, I actually would kind of do the same thing even for them, because diplopia or double vision is absolutely concerning for an MS relapse. I will just say chronically. So for chronic visual symptoms like double vision or nystagmus, even if it doesn't improve completely with acute therapy, there are special glasses that ophthalmologists can make for my patients and it does help with the symptom of double vision.
Thank you, Dr. Guerrero. Our next question is for Shannon. Are you aware of any support groups that meet in the evenings? I know you mentioned that they're during the day, but just in case someone with MS works during the day or they go to school?
You know, I don't know of any support groups in the evenings at this moment. The best thing to do is call the MS Society at 1-800-FIGHT-MS. And with that, you can talk to a navigator and they're able to tell you which groups are available.
Thank you. And then it's probably a follow-up question that was typed in. Is there a support group in San Diego? Probably, I know, Kate, is that part of the Southern California chapter?
San Diego is one chapter south of us, and there are lots of support groups in San Diego.
Yes.
Okay, great. Are there any other questions or comments for our panelists today?
I see some questions for me in the chat. So somebody was asking about stem cell therapy. So I can talk about that a little bit.
Okay.
There's two types of stem cell therapy. So one is hematopoietic stem cell therapy. That's essentially a bone marrow transplant. So our patients with relapsing MS can obtain that treatment at hospitals that provide it, or as part of a clinical trial. There still are ongoing clinical trials for hematopoietic stem cell transplant. So that's different than the mesenchymal stem cell transplant, which I mentioned. That we can actually obtain that from different cell lines in the body, and it has to be injected in the spinal fluid. There's only a couple centers that are doing studies with those types of stem cells. And like I said, the data is very preliminary right now. So any clinic in the community that is claiming to offer stem cells as a cure of MS, that is a sham. So I would steer clear of clinics kind of making these wild claims like that.
I'm reading a comment. When my son was diagnosed last year, they found several old lesions. Is there a way to know how long ago those occurred? For example, months or years?
That's a really good question. So the only aging we can do for the lesion is if it's brand new. So if the lesion enhances with the contrast, we know that lesion is approximately between 1 to 4 weeks old. That's how long the contrast stays in the lesion on average. Any other old lesion without contrast, we actually cannot be certain how long those have been there. So our best way of knowing is just based off of the symptoms. That's our best way of staging old lesions.
Okay, thank you. Before we move forward, let me see. I'm going to introduce Carlos Benavides. He is the president of the Commission on Disabilities for LA County. Carlos?
First off, I want to thank all the presenters, the doctors, Shannon. Great. It was a great presentation. I've been having issues, but I've been hearing everything that's going on. But it is an honor for me to be part of this space. As we dive into understanding MS in LA County, we're addressing a critical intersection of health, accessibility, and community support. Multiple sclerosis presents unique challenges, but in a sprawling metropolitan area like LA, the resources available through the Commission on Disabilities and the Aging and Disabilities Department are vital lifelines for navigating these hurdles. As we learned, there are resources out there, but there's a lot more to be found. Community connection would highlight the peer support networks and rehabilitation centers, such as Rancho Los Amigos, that specializes in neurological care. For many of our community members, MS affects the central nervous system, leading to various symptoms that impact daily life. Understanding the biological basis helps in advocating for better accommodations. I want to send out a special thank you to Guillermo Medina for all his hard work, along with the staff who continuously support all our venues. And with all the staff members to make sure that this podcast was a success. I want to thank everybody, and everybody be safe. Thank you, Guillermo.
Thank you, President Benavides. I do not see any more comments. If you have any questions coming up after this, please feel free to reach out to us. This concludes this MS webinar. I want to especially thank Kate Norton, Dr. Brooke Guerrero, Shannon Triplett, President Carlos Benavides, the rest of the Commission on Disabilities, Director Maral Karakusian, the entire Disabilities Division, especially Christina, who worked in the background to make this presentation happen, and our communications team. As you can see, this is truly a team effort. But more importantly, I want to thank all of you for joining us today and hear more from our great panel. We hope that you join us our future webinars. We've had 2 in the past on cerebral palsy. This one was on MS, so we look forward to expanding so we can learn more of what is out there for resources.
Guillermo, did you want to speak about the Commission on Disabilities real
Yes.
quick? Okay.
Thank you, Christina. So our commission meets the third Wednesday of each month. On the next one's on April 15th. You could email us to add you to the distribution list, and you could join us if we need assistance with advocacy work. If you feel that there's something that needs to be addressed, you're a person with disabilities, please contact us, join us. We want to hear from you. And so we could, get things going, make LA County more accessible for everybody. So thank you, everyone. Thank you so much, everyone.